True or false? PrEP is 100% effective in preventing HIV and AIDS.
False. I just said it. It's 92 to 99%.
That's such a bitch. Okay. Okay, so today we're going to test you on your knowledge of PrEP. How confident are you regarding PrEP?
Well, I prescribe PrEP to my patients regularly at my clinic, so I'm as confident as one doctor can be. True. No, I'm kidding. False. Truvada is not the best PrEP. Actually, PrEP or pre-exposure prophylaxis is just a method of taking medicine in order to prevent getting HIV. This medicine usually contains two types of medication, tenofovir and emtricitabine. Any medicine that contains these two guys who do the job, it doesn't have to always be Truvada. Currently, there are two major PrEP types. Well, currently there are two major types of PrEP in the market. One is the classical PrEP, for example, Truvada, which contains two types of medication, emtricitabine and tenofovir disoproxil. And also other generic brands, which contains emtricitabine and other soft formulation of tenofovir disoproxil. The second type is the newer type, which is DESCOVY. This one contains emtricitabine and tenofovir alafenamide. So I think the main decision is to consider between Truvada, classical PrEP, or DESCOVY. I usually would consider the patient's financial status, the coverage of the patient's insurance, and also patient's underlying diseases and his personal concern when it comes to long-term side effects. For Truvada, it may pose certain side effects like decrease in bone density or decrease in the filtering capacity of kidneys, while DESCOVY doesn't exhibit such side effects. There is no major difference between the generic brands, so pick whichever is the cheapest, I think, or whichever one that's covered by your insurance. False. You cannot just take PrEP on the day that you're having sex. There are two major regimens right now for you to follow when you take PrEP. One is the continuing PrEP, for example, you take daily dose of PrEP, and the second one is the on-demand PrEP. For example, the 2-1-1 regimen. The 2-1-1 regimen is when you take 2 pills 2 to 24 hours before you have sex, and then 1 pill 24 hours after the first dose, and then 1 pill 24 hours after the second dose. Please note that on-demand PrEP is only effective in unprotected anal sex between men. PrEP still works even if you don't take it at the same time every day. Actually, the reason we try to encourage the patients to take PrEP around the same time every day is that PrEP can become part of the patient's routine, so that they don't forget to take the pill. Well, with that said, you should not miss it for more than a couple hours, but if it's just like 1 or 2 hours, it's totally fine. False. But if you miss it for 1 day, for example, there's a study that if you take PrEP every day around the same time, the efficacy is about 92 to 99%, right? But if you miss it for 1 day, it will decrease to about 80-something%. And if you miss it for 2 days, it will decrease to about 76%. So these are things that you should consider before thinking of missing your PrEP. False. I just said it. It's 92 to 99%.
That's such a bitch. Okay.
You should keep in mind that PrEP do not prevent other STIs like gonorrhea, chlamydia, or syphilis, and only condoms that do the job. Hope you enjoyed this episode on PrEP. We have included some useful link below for you to check out. Please like, share, and subscribe to Dear Straight People, and we'll be back soon with a new episode.
So if you're taking like a generic brand, there's actually not much difference between the various generic brands like Truvada and the other generic brands.
No, not at all. They share the same efficacy, the same rate of side effects. So you actually can consider Truvada or generic brands.
So can you say that in like one sentence? If you're going for a generic brand, there's actually not much difference between the various brands.
Oh yeah. I didn't say that, did I? Okay. Okay, ask again.
Can you say that again?
Bitch.